Welcome back to my program entitled Dr. Guy's Joint Repair Formula. Today, what I want to do is very quickly go through parts 2 through 5. So I'm going to move a little bit quicker than we did when I discussed the benefits of SAMe. SAMe does a lot, and I'm going to be making a reference to that previous presentation quite a bit. So I'm assuming that you got all that information so that we don't have to repeat it over and over again for these other guys. If you understand the majority of what I talked about in the discussion on SAMe, then these other guys will make a lot more sense. So hopefully, in spite of this being briefer, it will make sense, and you will have some understanding as to why I recommend these particular agents when it comes to getting relief from your arthritis. Okay? So let's jump right into it. This is a slide that we saw in the last presentation where we liken the worn or damaged cartilage to a pothole in the road. Because when you have a lesion, when you have an injury site in a joint, it kind of looks like a pothole. This is an area where you have worn down that cartilage that protects you from experiencing bone-on-bone action. Okay? So, what we're trying to do with all of these therapies is to reduce inflammation, of course, but also to rapidly accelerate the healing of these various potholes. Okay? Now, keep in mind the components of our connective tissue. You have your chondrocytes. Those are the stars of the show. The chondrocytes are living cells that are in that cartilage that are busy producing the type 2 cartilage. And the type 2 cartilage, those are your steel girders. Those are the things that give you strength when it comes to that joint cartilage. Okay, type 2 cartilage, very important. And chondrocytes, or cartilage cells, are the structures that produce type 2 collagen. And in addition to the type 2 collagen, you produce that slimy, slippery stuff called proteoglycans or glycosaminoglycans. Now this is really important, what I'm about to say next. What are glycosaminoglycans, also called proteoglycans? What are they made up of? Two things: keratin sulfate or chondroitin sulfate. Okay, both. I mean, those feathery structures. If you take a look at this particular slide here, again, the blue structures are your type 2 cartilage. The white, feathery, spindly type things, those are your glycosaminoglycans. And those individual lines, if you will, those things that look like, needles on a Christmas tree, those individual needles are made up of either keratin sulfate or chondroitin sulfate. So it's a mixture of keratin and chondroitin sulfate. Now, the precursor to keratin sulfate and chondroitin sulfate is glucosamine. So right there, you understand the basis of why do we take glucosamine with chondroitin sulfate for arthritis. Well, the glucosamine is the precursor for keratin sulfate and chondroitin sulfate is chondroitin sulfate. So you are then consuming the very materials that your chondrocyte is going to be using to repair the joint cartilage. So you can stop right here. That's, in a nutshell, that is what these things do. But you probably don't want to stop here because there's more cool information coming. All right. So this is just a picture showing you, the individual proteoglycan aggregate, and showing that, these core proteins and lipoproteins, that the business end, the actual needles on our Christmas tree here, are the keratin sulfate or glycosaminoglycans, or keratin sulfate or chondroitin sulfate. Those make up your your proteoglycans, also called glycosaminoglycans, GAG. And here's a close-up where you see the chondrocyte, and it's busy making your type 2 collagen as well as your proteoglycan aggregates. This is a picture that we saw last time where you're looking at a scanning electron micrograph. That's an electron microscope picture of what the joint cartilage looks like. So you see these greenish structures, which are your chondrocytes, and then the pink granular substance, that is that's your glycosaminoglycans, made up of Once again, those feathery structures that are glycosaminoglycans made up of keratin sulfate and chondroitin sulfate. So again, the articular cartilage provides a slippery, durable, moist cushion that prevents the bone from grinding against bone in that joint, because there's movement going on. Movement implies friction, and friction can cause wear and tear. You don't want dry bone rasping against one another. We don't want to see that happen. That's why you need this nice, slippery, moist, bouncy cushion. Okay? Arthritis can range in stage from mild to moderate to severe, to very severe. And by very severe, you have no articular cartilage left. You're down to bone on bone, at which point it's unlikely that these recommendations that I've made, it's unlikely that they're going to do you any good. If you're at those advanced stages, you're kind of ready for a joint replacement. So this is probably not going to be helpful for you. The people that will get the most out of this joint repair formula are those who have early stage arthritis. You are at a place where you have a few potholes, but you haven't completely worn away the cartilage. You have chondrocytes in the area. You need that, because it's the chondrocytes that are going to respond to these supplements. So supplements plus chondrocytes equal repair. Your chondrocytes are your workers. Those are your construction workers who are going to do the work. And when you're taking supplements, you are giving our construction workers the tools that they need to effect repair. Okay, so imagine a road crew. You got these guys working, right? Well, what if they don't have enough asphalt? What if they run out of shovels? Doesn't matter that they're on the job. You're not going to fix the potholes because they need materials. And the supplements give your workers the materials necessary to repair the potholes. Now, let's start. This is something that wasn't on my list to discuss, but I think it is important to talk about. Because we're going to get into undenatured collagen next, and that's really cool. But before that, there's something called denatured collagen, or gelatin. Okay, it's kind of the same thing. And gelatin or denatured collagen, those are connective tissues. That's like the gristle part of the animal, the breastplate, the breastbone, if you will, and the joints. And is it possible to eat that stuff, to eat gelatin, to eat denatured collagen? Does that work? Turns out, yes, it is helpful. Collagen or connective tissue is made up of specific amino acids that are slightly different in composition than the amino acids that make up muscle. All right? So it is higher, for example, in the amino acid proline and so forth. So when you consume denatured collagen, when you consume gelatin, such as what's in Jello, okay, you can buy gelatin, that actually does get taken up by your body and used to repair connective tissue, to repair cartilage. Turns out that's the case. We've seen that in animal models for sure, and we presume that's what's happening in humans as well. So yeah, that is actually useful. If you eat 3 or 4 or 5 grams of gelatin or denatured collagen, that does help your body to repair joints. So this is actually useful. So that's almost common sense if you think about it. And this right here is a meta-analysis. This is published in October 2018. The title of the paper rather is Effective Collagen Supplementation on Osteoarthritis Symptoms, a meta-analysis of randomized placebo-controlled trials. And they looked at quite a number of trials where the subjects ate collagen, denatured collagen, and they followed, look at the symptoms. Does it affect range of motion? Does it reduce pain? Therefore, is it helping with the arthritis symptoms? Turns out it does. And there was one animal study where they actually radio-labeled the proline, which a proline is a specific amino acid found in connective tissue, and they wanted to know when the animal consumes the gelatin, does it actually turn up in their joints? Does your body use ingested collagen to build your own joints? Turns out the answer is yes. So that's a good thing. And this just shows you a picture of a beef gelatin powder. That's something that I use. I will mix that in with my protein shakes. Doesn't affect the taste bad in any way. And it does help your body repair your joints, and I have noticed some benefit with that. So that's one recommendation here that isn't part of my normal Dr. Guy's joint repair formula. It's something that I recently added, and the studies do suggest that this is helpful for rebuilding joints. So that's a recommendation. It's called Denatured Collagen or Gelatin. All right. Now, Undenatured collagen, undenatured type 2 collagen. This is different. This is different because what I just suggested, is gelatin that you have to take in pretty high amounts. So we're talking not milligrams, but grams. And your body does use this in a food way to build up your joints. So that's good. Undenatured type 2 collagen works very differently. For one thing, this is not something that you consume in bulk. This is not something that you need grams of. 1 gram is 1,000 milligrams, all right? It turns out undenatured type 2 collagen, the dose necessary to improve your arthritis symptoms is a mere 40 milligrams. This is a tiny, tiny amount, but it has been shown, it has been demonstrated that this tiny amount of undenatured type 2 collagen is more beneficial for range of motion and pain control than 1,500 milligrams of glucosamine with chondroitin sulfate. Wow, that's saying something. I mean, because I've been using glucosamine with chondroitin sulfate for years. When I don't take it, I notice the pain comes back. So personally, I've experienced benefit with this agent, and in the clinical trials, undenatured type 2 collagen was superior to that. So it got my attention, and this is one of my more recent additions to my own protocol because the studies were so impressive. And there are many different brands, and I can't tell you which brand is better. It's Undenatured type 2 collagen. There, Jarrow has some. Now has some. Now has done some really brilliant studies with their particular product. But all of these, Source Naturals, all these guys are sources of undenatured type 2 collagen. All right. Now, essentially, it is not the type of collagen that ends up going into your body and becoming the cartilage itself. What it does is in a nutshell, it stimulates your chondrocytes to make cartilage, to make type 2 collagen and the glycosaminoglycans. That's what it does. It helps to do that. And later on, in a minute here, I'm going to go over the mechanism by which it is believed to work. But I want to talk a little about the studies that have been done on it. Where most of these companies get their undenatured type 2 collagen is in the sternum of your chicken, for example. That's pure. It's not bone. Where the ribs come together, the sternum here, that is cartilage in chickens, and that's where most of this type 2 collagen comes from. All right. We have a number of studies that have been done to demonstrate that this is effective. And I'm going to talk about a couple of them. In the first one, this is an unusual study for arthritis because, as you might imagine, most of the studies done for arthritis are done in people with arthritis, obviously. Okay. Here, what they did was they looked at healthy volunteers. Nobody in this study had arthritis. And all they did was exercise in the study. Now, if a normal person does a pretty rigorous exercise where you're going up on stairs, up and down and up and down, that normal wear and tear will cause some pain. That normal wear and tear, as the pain ensues, will result in some limitation in range of motion. Okay, what do I mean by range of motion? Well, for my elbow, here's full extension, all right? And then this is flexion, okay? And so then a diminished range of motion would be if I was only able to go to here, okay? And with the knee, if you wear out your knee, if you undergo rigorous exercises using your weight or increased weight, then your knee loses range of motion. And so the study was to see, okay, let's take a look at normal volunteers. Let's take this product, this undenatured type 2 collagen, and let's see the difference between healthy volunteers, between those who take the product and those who don't, who go through those exercises. Does it make a difference on pain and range of motion? Okay? All right. So here we see the healthy subject study. And the gray lines, if you take a look at the right-hand side, the gray bars represent the placebo group. So these are individuals who got the sugar pill. And then the olive-colored bars are individuals taking the Undenatured type 2 collagen. And notice how long they were. Now, this is 40 milligrams a day. And notice how long this study was, 100 up to 120 days. So 4 months, okay? So we got the 60 days, 2 months, 90 days, 3 months, 120 days, 4 months. And what you see in terms of range of motion, and these are, again, people without arthritis, healthy people just doing these exercises every day. What they discovered was that by the time you got up to 60 days, there was just a little bit of difference, okay? So after 2 months, there was a little improvement. But boom, you get to 60 days and 120 days. So at 3 and 4 months, there was significant improvement in range of motion in the patients that were taking 40 milligrams of undenatured collagen a day. That's really good. I mean, it's statistically separated from placebo. So there are 55 people in this subject. So it's a pretty good sized study. All right. So, and also that was the primary endpoint, was looking at range of motion. The secondary endpoint was pain. How long before knee joint pain started to occur on the step mill, and how long did it after they got off that step mill? The step mill is kind of like those stairs that you go up. Okay. So how long before the pain started, and how long did it take the pain to go away? WOMAC is a method of measuring arthritis disability. Okay, WOMAC stands for the two universities that collaborated to come up with this. The Western Ontario, Western University of Western Ontario and McMaster University. That's where you get the name WOMAC. And basically, it measures pain, flexibility, and range of motion. All right, that's the WOMAC index. There are 24 items divided into 3 subscales, so it measures pain during walking, using stairs, laying in bed, sitting or lying and standing upright. Also measures stiffness, and then physical function. How impaired are you using stairs, rising from sitting, standing, bending, and so forth. That's what the WOMAC index is based on. Now, the reason that I bring this WOMAC index up is because this next study, which was done in 2016, looked at the WOMAC index, looking at 3 groups. Okay, one group received placebo. The second group was placed on normal levels of glucosamine with chondroitin sulfate. So you're looking at about 1,500 milligrams there. Okay, 1,500 milligrams of glucosamine, 1,200 milligrams of glucosamine sulfate. That's the normal dose that people take for arthritis. Okay, and the third group received 40 milligrams a day of Undenatured type 2 collagen. And what we see here, looking at WOMAC score reduction, because the higher the score, the more the disability, the more the pain, the lower the range of motion, and so forth. And you want low scores. And what you see here is that all 3 groups, placebo, the glucosamine group, and the Undenatured collagen group, they all went down. Now, what is really fascinating about this study is that the glucosamine with chondroitin sulfate, which has been beneficial for many people, including myself, it did better than placebo. But even after 180 days, it did not reach statistical significance. And so, in other words, while this study does seem to show that glucosamine with chondroitin, by the way, that's the flesh-colored one in the middle. That's the pinkish line in the middle. So the blue line is placebo, the pinkish flesh-colored one is in the middle, and then the last one, I believe that, what is that, black or green? I can't tell. My eye's not that great this time of night. I think it's olive, okay? Anyway. So, glucosamine didn't separate from placebo, so you can't say with scientific accuracy that glucosamine was better than placebo. Okay? It's kind of sad, but that was the case here. Now, the last one, the olive one, by 60 days, at the 2-month mark, when you see that little asterisk underneath it, that tells you that it achieved statistical significance. So it was better than glucosamine with chondroitin sulfate, and it was better than placebo. It was demonstrated better by 60 days. And the improvement continued on all the way out to 180 days. Okay, so that says that this is very significant. You know, one of the complaints people often raise about glucosamine with chondroitin sulfate is we have a number of negative studies showing that while people might think that it helps them, we have a lot of studies that fail, that show that it didn't help. And I personally have had great experience with it. So why do we have studies that show glucosamine with chondroitin sulfate didn't help people? Like I said early on when I talked about SAMe, if you include in your study people with more advanced stages of arthritis, when they're down to bone on bone, or when they are missing massive amounts of their articular cartilage, there's not enough chondrocytes in the area to respond to your agent. And it works on chondrocytes. It helps your chondrocytes have material so they can rebuild cartilage. If your arthritis is so bad that you are short on chondrocytes, then none of these agents are going to help you. And I personally believe that is why so many studies fail to show statistical significance with glucosamine with chondroitin. Now, in this particular study, I don't know how severe the arthritis was in the people, because in this study there were people with arthritis. I don't know what that was, but what is very important here is that the people who got the undenatured type 2 collagen, 40 milligrams a day, it's significantly separated from placebo. This is a very successful study showing efficacy. And so for this reason, I have definitely included this in my own repertoire. And I think I've seen some improvement. My symptoms were already pretty well controlled, but this, in my opinion, the number of days without pain seems to be higher since I have started adding the undenatured type 2 collagen to my repertoire. Now, how does it work? What is the mechanism of action? Little bit complicated, just a little bit, and I'm going to go through that with you, because it's not like it's a food that your chondrocytes can use to build collagen. It doesn't quite work that way. It's a little bit different than that. There are a couple cells in the gastrointestinal tract and throughout the body, immune cells, that are very important. Macrophages and dendritic cells. Both of these are important and play a similar role. They work like one another. Okay. Now, dendritic cells they're on all over your skin, and they line your GI tract. Okay, and what do? Well, these are ports of entry into your body. And so what they do is they arrest certain antigens. Now, what are antigens? These are molecules that are foreign to your body that might do you harm. Okay? So, what do you do with these illegal aliens? Well, you don't know if you can trust them. And so when you get these illegal aliens trying to penetrate your body, these dendritic cells, what they do is they present these aliens to your military. So your military can study them and come up with a defense against them if you need it. So what happens? Undenatured type 2 collagen is an antigen. Okay, it is kind of foreign, and yet it's part of your body. Okay, collagen is in your body, but when you take it by mouth, it is seen as an antigen that gets attention, and so in aligning your gut epithelium, so we're talking about your esophagus, your stomach, your small intestine, especially small intestine, and throughout your GI tract, small intestine and large intestine, you have these areas called Peyer's patches, which are collections of immune cells. So anyway, so your epithelial cells, your GI tract is lined with cells, okay, with different types of epithelium and so forth, but interspersed you have these cells called M cells, all right? And M stands for microfold, but if you can just remember M-celled, and this is kind of, I think of military police too in that regard, but think of M microfold military police, all right? So what they do is they are there specifically to arrest antigens that might pose a problem. So what the microfold cells, what the M cells do is they suck up the antigen and they immediately present it to the dendritic cells. Okay, and the dendritic cells, those guys are responsible for then presenting the antigen to the T cells or B cells, so that you can If you need to attack it, you can. If you need to make antibodies, you present it to a B cell. If you need to activate what we call T cell immunity, you present it to a T cell. And it can literally, when it presents to the T cell, it can transform the T cell into a different kind of animal. So let me go over the specifics. And again, if you have any medicine background, this will make a lot more sense to you, but I'm hoping that anybody can understand. So take a look at this picture here. You see the gut mucosa, and notice at the very top you got bacteria and various antigens. And you see the epithelial cells called the enterocytes standing next to one another. Those little fingers are called villi. And those are important for the absorption of nutrients from your small intestine. Okay. Now, most of these cells are enterocytes, but then you have this M cell here, and it's specifically there. Why? Because some of the things that come in your body are illegal aliens that might need the attention of your military. So the M cells suck up the antigen, in this case, the undenatured type 2 collagen, and they present it to the dendritic cell. Okay. So what did the dendritic cells do? They present it either to a T cell or a B cell. In the case of, if the antigen is undenatured type 2 collagen, it specifically goes to the T lymphocyte. All right, so in this picture here, you have that police officer in the middle. That's your M cell, okay? And the undenatured type 2 collagen, that's your villain that he's got his hand. And so he's presenting the villain to the police or the dendritic cell, okay? So the dendritic cell takes that baby, and with the help of two substances, retinoic acid, which is half of a vitamin A. So if you take vitamin A and you cut it in half, that's a retinoic acid. So that's important. So in response to retinoic acid and a substance called TGF-beta, or transforming growth factor beta. In response to those two things, when the dendritic cell gets a hold of UC2, it transforms the T cell into something called a T regulatory cell. And when the T regulatory cell is created, what does it do? It spits out high amounts of transforming growth factor beta. And the other thing that it increases, that it produces a lot of, is something called interleukin 10. Now, why is that important? Why is it important for the T cell to turn into a T regulatory cell and spit out those two substances? Because those two substances, so the T regulatory cell travels all over your body. So this causes a series of events, so that suddenly the bunch of your T cells have turned into these T regulatory cells, and it is spurting out TGF-beta and interleukin 10. And these substances, they activate the chondrocytes. So all of the chondrocytes throughout your body, in your skin, in your joints, they then become activated to do what? To make collagen. Okay? That's how it works. So in this way, this UC2 undenatured type 2 collagen stimulates the T cells to turn into T regulatory cells, which produce TGF-beta and interleukin 10, which go through to all of your chondrocytes in all of your joints, and it makes them produce more collagen and extracellular matrix here, so that you are repairing your joints. That's what it's doing. It stimulates your joints to get on the ball and to get repaired. So you make more elastic cartilage, make more hyaline cartilage, and you make more fibrocartilage. And that fibrocartilage is the cartilage in your joints. That is what is under attack when you have arthritis. Okay? So think of it this way, and this is a poor illustration, but it might help you to keep in mind how this is working. So in the top here, you have your chondrocytes. As I mentioned earlier, those are your workers. So think of filling potholes, okay? So the chondrocytes, right below it, you have these two workers dressed in orange, and they're on the job. And what is their job? To tear up the old damaged pavement and to lay down brand new asphalt so that you don't have potholes. Now, when you take glucosamine with chondroitin sulfate, what do those do? Those guys are food. It's like your asphalt. That is the material that your chondrocyte uses to make more glycosaminoglycans. Remember, articular cartilage, joint cartilage, is made up of type 2 collagen and glycosaminoglycans. Okay, and so glucosamine with chondroitin sulfate gives you the material you need to make those glycosaminoglycans. What is UC2? What is this undenatured type 2 collagen do? It's like, I got a picture of a chicken sandwich there. Those are delicious, by the way. I like chicken sandwiches, especially from, anyway, I don't want to get into that. But got a chicken sandwich. What does those chicken sandwiches do to your workers? Well, if they got some food in them, they're going to work harder. They're going to do their job a little better. So food stimulates the workers to work harder so they can get that road fixed. And that's kind of what UC2 does. That undenatured type 2 collagen ultimately transforms those T cells so they can make those substances so that it will make the workers work harder to produce more collagen. Okay? So those are your, and you know, what about the other type, the denatured collagen? Well, that's the same thing. Look at that asphalt. That's what the denatured collagen does. That, again, that is more material that your workers are going to use to fix the pothole. So hopefully that makes sense to you, so that, you know, when you use UC2, you are stimulating your worker to get off his booty and start to work. Kind of like a chicken sandwich might, okay? All right, so that's your proposed mechanism of action. UC2, it induces the T regulatory cell to be formed, and that produces interleukin 10 and TGF-beta that may modulate cartilage breakdown. So it helps to repair the old damage and to stimulate production of new cartilage. Okay? So the normal daily wear and tear on the joint is mitigated, so that while you have that wear and tear, we are now stimulating the joint repair cycle with these substances. That's what a pothole looks like, in case you've never seen one. In Michigan, we see them all the time, but I realize people from other states might not know what a pothole looks like, because we seem to have the worst roads in the country. What do you call that? When you work through the immune system the way undenatured type 2 collagen does, that's called oral tolerance. And so it's kind of like, well, I don't want to confuse you. So just keep in mind the illustration, keep in mind the chicken sandwich, you know, so you understand that it works by a different mechanism of action than collagen building blocks. So what uses collagen building blocks? Glucosamine, chondroitin sulfate, denatured type collagen, such as what you get in gelatin, even SAMe. These are building blocks that the chondrocyte needs to do its job. Now, I talked about glucosamine with chondroitin sulfate for arthritis, and we've been using this in animals. You know, dogs get arthritis, and that's readily available for animals. People, you know, get benefit from it. There are lots of industry-sponsored studies that show that glucosamine with chondroitin sulfate is helpful. They're hit or miss. Some studies show great efficacy, others not so much, you know, depending on who's doing the study. This is something that, when it comes to glucosamine with chondroitin sulfate and MSM, I'll throw that in there as well. These are all substrates or materials that your chondrocytes need to repair a joint. And in my clinical experience, most people get more benefit, including me, get more benefit from glucosamine with chondroitin sulfate than glucosamine with MSM, but some people do get the benefit with the MSM. I say play around with it and you figure out which one works better for you, or if it works. Keep in mind, though, that this is something that I would recommend that you take it at the therapeutic doses at least 4 months before you give up on something, because it does take a while for your body to use these substrates to repair the joint, okay? And when you stop using it, if you notice in a couple days that your pain gets worse, that kind of tells you that it was probably doing something, okay? So I'm not going to spend more time on glucosamine with chondroitin sulfate, because if you understand, I think you understand now the mechanism by which it works. And again, there are some studies that show that it didn't help at all. And again, when you include people in your study who are down to bone on bone, that's going to throw your results off quite a bit. Now, there is some evidence that glucosamine also has some anti-inflammatory properties itself. So that right there. So not only may it be useful as a substrate so that you can make, you know, these proteoglycans or glycosaminoglycans more readily, it also helps reduce some of the pain and swelling and injury caused by the inflammation from the arthritis itself. Proposed mechanism here, it has an anabolic effect by stimulating the production of extracellular matrix of the cartilage. And so I talked about that ad nauseum. There is evidence also that chondroitin sulfate, in addition, it suppresses inflammatory mediators and inhibits cartilage degeneration as well. All right, so I'm going to be done with these guys, and we're going to move on to the next one, and that is ginger. Now, ginger is not something that I necessarily recommend for everyday use. If you have really painful arthritis that bothers you every day, then yeah, you can use it every day. All right, if you think, what is the purpose of ginger? Well, it's kind of like it serves the purpose of ibuprofen. When people take ibuprofen for their arthritis, why are they taking it? They're taking it because it hurts and they want the pain to go away. They have active inflammation that makes movement difficult. They're hurting. And so you take an ibuprofen to reduce that. Well, the reason that I'm not a real fan of ibuprofen is that that's rough on your kidneys, okay? It really is. And as a result, your kidneys over time can suffer if you're taking high amounts of aspirin or ibuprofen. Ginger is an anti-inflammatory that is about as strong as ibuprofen is without the damage to your joints. So in a nutshell, that's it. Ginger is a great natural anti-inflammatory agent. Now, how much does it take? Well, in the clinical trials, it showed that it's helpful about 2 grams. So that's 4 500 milligram capsules. And in my personal experience, if that doesn't do it, if I've got a really bad joint that's killing me, I'll go with the 4 ginger capsules first. And if that doesn't take care of the pain within 2 hours, then I'll take another 6 capsules. And I have to say, that always works. That does the trick, okay? But, you know, this is not a drug. It is a natural agent, and so your doses are quite a bit higher than what you would use if this were a drug consisting of 1 molecule. The most potent constituents of ginger are gingerol and shogaol, all right? Those guys are substances that inhibit prostaglandin and leukotriene biosynthesis, so the suppression of 5-lipoxygenase or prostaglandin synthetase. Additionally, what you're doing is inhibiting the synthesis of pro-inflammatory cytokines such as interleukin-1, tumor necrosis factor alpha, and interleukin-8. Now, there are quite a few other things that it does, and I'm not going to go into all those guys because most of you don't have a degree in biochemistry or physiology or anything, but I just want you to get the point across that this has demonstrable anti-inflammatory effects which help with the pain when you are really hurting with musculoskeletal injury, such as what we're seeing with acute arthritis. So that's why you keep ginger in your medicine cabinet. That's what you want to, if you have arthritis, ginger is your friend. Now, you can buy ginger capsules. What I do, because I do use this kind of regularly, well, I haven't used it lately a lot, but in the past, when I have had some pain, what I do is I go to the Indian grocery store and I buy ginger in bulk, okay? And then I have a capsule filler, and I make my own capsules of it. So I can, you know, for $7 or $8, you can get like a pound of ginger powder, all right? And you can make enough ginger capsules to last you a year, and it costs almost nothing. Or you can just buy ginger capsules at the store, okay? They're pretty readily available. Okay, next up, vitamin K2. It's getting a lot more popular now. 10 years ago, I had not heard of vitamin K2. Now, there are several vitamin Ks. You got vitamin K1, which is phylloquinone, and then you have vitamin K2, which is menaquinone. All right, and they come from different things. Vitamin K1 is made in plants and algae, leafy green vegetables. That's where you get K1. K2 is found in meat, dairy, eggs, certain bacteria, fermented foods such as cheese, yogurt, fermented soybeans. Vitamin K does its thing because it induces calcium use by certain proteins. Okay, vitamin K2 is essential for calcium use, and it helps to build strong bones, and it inhibits arterial calcification. So when you think of vitamin K2, think of, okay, we got all this calcium in our bodies, and when our bodies are lazy, it deposits calcium in the wrong places. And one of the really wrong places that calcium gets deposited is in blood vessels, along arteries, okay? When I was a radiologist, one of the things that we saw very commonly when people get older is when you do an x-ray of their body or a CT scan, and you can actually see calcium bones show up as very white on x-ray or CT scan. And as people get older, if you don't have enough vitamin K2 in your diet, then you deposit all of this mineral, all of this calcium in your blood vessels, so you can see on x-ray your aorta, all right, and all of these, and your coronary arteries and everything. And the more calcium you have in your blood vessel walls, the greater your risk of arteriosclerosis. All right, that is a sign of that. So it's really unhealthy. So vitamin K2 helps you to deposit calcium in a healthy way. Another really unhealthy use of calcium is to deposit it on your bones in the wrong places. It's what you call bone spurs. Bones, normally, if you take a look at a vertebrae, you should see this nice cuboid structure with nice right angles, like a sharp marshmallow, okay? As people get older, and if they don't have good calcium mineralization, your body gets lazy, and towards the edges of the vertebrae, you'll see this scalloping. All right, those are called bone spurs, and they can actually stick out so far that they press against nerves and cause nerve pinching and pain and things like sciatica. And so vitamin K2 helps these proteins use calcium appropriately to avoid dystrophic calcification. Dystrophic, like a dystopic, is like a bad situation. Dystrophic calcification is calcium being deposited in a lazy, crappy way in the wrong place. It doesn't belong in your arteries, and it doesn't belong on the corners of your bone, okay, where it can poke nerves, okay, and other blood vessels and things. All right. So we want the proteins regulating calcium. The calcium regulating proteins need to be able to do their job, and in order to do that, you have to have adequate amounts of vitamin K2. At least 32 micrograms of vitamin K2 per day is recommended. Okay? So if you have arthritis, it's very common because your immune system is attacking your bones, and so your bones are ripped apart and put back together, ripped apart and put back together. If you don't have adequate amounts of vitamin K2, when they get put back together, they're more likely to get reassembled sloppily, and you're going to see bone spurs. And that can take place in your heel with heel spurs and along your vertebrae, leading to back pain and problems and so forth, and along other joints causing joint pain. So vitamin K2 is really helpful to prevent dystrophic calcification. A large-scale study published in 2013, the American Journal of Medicine, confirmed that nearly 60% more risk of osteoarthritis occurred in people who lack vitamin K. Additionally, the study also showed that in 15% of patients who initially did not have any symptoms and lacked vitamin K, there was a development of osteoarthritis after 30 months of the study duration. In conclusion, the research group highlighted the potential of vitamin K as a simple and acceptable treatment for osteoarthritis, a condition that is often and seriously lacking an effective therapeutic option. Oh, vitamin K2, very, very important. That is Dr. Guy's joint repair formula. We have a few things on there, so to recap, SAM-E, and then denatured collagen, which is gelatin, and then undenatured type 2 collagen, ginger for breakthrough pain and inflammation, and then vitamin K2 to help reduce the risk of dystrophic calcification. And this helps prevent bone spurs and calcium deposition in your arteries and a lot of pain and sciatica from improper calcium deposition on your existing bones. Okay? So I hope this helps you. I hope that with this you have a better understanding of why I recommend the things I do for the treatment of your arthritis. And again, why is the psychiatrist talking about arthritis? Because if it hurts every time you move, it's going to affect you psychiatrically, okay? It affects your sleep. It affects the quality of your waking life quite a bit. It's one of those conditions that is very, very common, and I'm not really a big fan of the medications that are used for autoimmune disorders, these things called biologicals. As I mentioned earlier, the biologicals reduce your ability to fight cancer. That's not a small thing. So I'm not saying you should never take them. I'm not saying that. But what I am saying is that if these natural agents are effective at reducing your pain, and in fact, if you're early on in the disease, you can have days and days of being pain-free. Okay? And so that if we can postpone when you need these biologicals, it could literally not just improve the quality of your life, but the length of your life. So thanks for watching. I hope that this helps.